Good evening, everyone, and thank you all for joining us today on Morris News, America's most reliable news source. I'm your host, Cassie Conlon, and I'm here today to bring you breaking news about a new drug that was just FDA approved as of today. The drug is Eteplirsen, and it's the first FDA-approved drug to treat Duchenne muscular dystrophy. Until now, people born with this disease were lucky to live to see their 20s, but thanks to this new miracle drug, all of that could be changing. I'm going to send it over to Dr. Meredith Gray, who's going to explain more about this disease and about this new drug to treat it. Over to you, Doctor. Thank you, Cassie. Hi, everyone. I'm Dr. Gray, and I'm here to talk to you about DMD and Eteplirsen. DMD is a genetic disorder characterized by the progressive weakness of skeletal and cardiac muscles. It is caused by a mutation in the dystrophin gene, which ultimately results in the inability to produce the protein dystrophin. Dystrophin is a protein involved in maintaining the integrity and structure of muscles, as well as transmitting muscle contractions throughout the entirety of the muscle. Ultimately, death from this disease does not result from the weakness of the muscles themselves, but from the consequences that come from this. Weakening of cardiac muscles will eventually result in a heart too weak to function, which will result in cardiac failure. Weakening of intercostal muscles, which are between the ribs, are involved in breathing, and weakening of these muscles will eventually lead to respiratory failure. In normal individuals, the gene is transcribed and the mRNA that comes out of transcription is processed to produce these exons. These exons are then able to come together perfectly and fit together to produce a fully functional mature mRNA, which is then translated into a fully functional dystrophin protein. In individuals with DMD, one of these exons is deleted, and therefore, when transcription and mRNA processing occurs, one of these exons is missing. So when the remaining exons try to come together to produce a mature mRNA, they won't fit together. Notice that they're different sizes. And thus, when they try to come together, it'll produce a prematurely truncated mRNA, which will not be able to translate to produce a functional dystrophin protein. Eteplirsen works to fix this issue via a mechanism called exon skipping. The idea behind exon skipping is to silence a gene in order to try to find a match between adjacent genes to produce a truncated but still partially functional protein. Specifically, Eteplirsen is a type of antisense oligonucleotide that targets exon 51 and silences it. So Eteplirsen binds here to exon 51 and causes the gene to be silenced. Therefore, when transcription and mRNA processing occur, this gene will also no longer be present. And then, when these two genes try to come together, they'll be able to come together, even though they weren't supposed to. And thus, this will produce a truncated dystrophin protein, which is partially functional. Although this protein is not fully functional, it's still better than having no protein at all, and thus Eteplirsen works to fix this disease. Unfortunately, Eteplirsen is only able to target exon 51 for silencing, and the mutations that are susceptible to fixing via exon 51 skipping only include 13% of people suffering from DMD. Therefore, we need your help to raise awareness and give donations to help fund research to find more drugs to help fix mutations that everyone else suffering with DMD has. Thank you for listening. Back to you, Cassie. Well, that's all we have for today. Thank you for listening, and we'll see you next time on Morris News.